Some of you will treat infection today and still find yourself back in the pharmacy next week. Like, hi, it came back again. But have you ever stopped and asked yourself why it keeps coming back? You've tried everything, or so you think, but somehow it's always returning. Now, the thing is, there's something you're doing or not doing that is keeping this cycle going. And today, we're going to uncover it. Just sit down, relax, as this might be the answer you've been missing. Hello and welcome to my channel. My name is Sandra. I'm a registered nurse and midwife with a BNSC degree. On this channel, we'll talk about all things health. If these are the type of content you're interested in, please do not make it your last by clicking on the subscribe button and the bell icon beside it so that when I upload a new video, you'll be the first to get notified. Please don't forget to like this video. With that being said, let's dive straight into the video. The first reason why your vaginal infection keep coming back is because you're taking the wrong medications. Now, you've been complaining about your infections coming back, but the question is, are you sure you're taking the right medication? One common thing that most of us do is that because we were treated with a particular medication when we had an infection, you just save the name of that medication. When next you're experiencing similar symptoms, you go over the counter and tell the pharmacist, I want to buy this medication, without really knowing if it's the same infection or if that medication is actually what you need. This can cause the infection to linger because antibiotics are designed for specific infections. They can't just work on anything. Some antibiotics are bactericidal, which means they are designed to kill the bacteria, while some are bacteriostatic, meaning they are designed to stop the growth of certain bacteria. So the infection you have will determine the medication you'll be prescribed. Now, if you're treating your infections with the wrong medication, you're not killing the bacteria and your infection will keep coming back. That is why it is always advisable to get tested. You'll be asked to do the MCS test. That's the microculture and sensitivity test. This test would help your doctor determine the type of infection you have, the drugs they are sensitive to, and the appropriate antibiotics that work well to treat the infection. So sis, if you're always taking the same medication whenever you have an infection, that can be the reason why your infections keep coming back. Another reason why your vaginal infections keep coming back is prolonged use of antibiotics. When you use antibiotics for an extended period or when you use it incorrectly, it can disrupt the balance of bacteria in your body. The vagina has what we call the good and bad bacteria. Now, when you take antibiotics for an extended period, it not only kills the bad bacteria, it can also wipe out the good bacteria, like the lactobacillus, which helps to prevent infections like yeast infections. When the good bacteria are reduced, it allows harmful or bad bacteria or fungi to grow in the vagina, which can lead to recurring infections. So, taking antibiotics for an extended period could be one of the reasons why your vaginal infections keep coming back. Another thing is not completing your full course of treatment. One thing you must know is that it is super important for you to finish your treatment. Some of us will be given a medication to take for 5 days, 7 days, 2 weeks, depending on the course of treatment. You will take the medication for a couple of days. Once you start noticing you don't feel the symptoms anymore, you stop taking the medication. I know it's easy to feel better and think, yes, I'm done, I beg. But the truth is, if you don't finish the course of your medication, you are leaving room for the infection to bounce back and even stronger this time. Maybe you don't know bacteria are sneaky. They will come back in full force. So the thing is, if you're one of those people that don't finish the full course of their treatment, that could be one of the reasons why your vaginal infections keep coming back. Another common reason why your vaginal infections keep coming back is you might unknowingly be reinfecting yourself. Imagine going to the hospital to do a test. You were given the right medications and you completed the full course of that medication. Then you go back to the same partner who might have the same infection and has not gotten any treatment. What do you think would happen? And now you're all happy that your infection is gone. Meanwhile, your sexual partner isn't treated. I'm sorry to disappoint you, sis. That infection will keep coming back. That is why it is important for you and your partner to get treated at the same time and avoid sexual intercourse for that duration of treatment. So break this cycle. If after treating your infection, you go back to your partner who is not treated, that can be the reason why your infections keep coming back. Another reason why your vaginal infection keep coming back is hygiene. I know we all want to feel clean and fresh down there, but certain hygiene practices could actually be doing more harm than good, such as using scented or harsh soap to wash your vagina or vulva area, douching, wearing tight, non-breathable clothes, or wearing damp or wet clothes. These things can irritate your vaginal area and make infections more likely to come back. Just keep things simple. Don't wash the vagina. Wash the vulva area with water and mild soap. Wear breathable clothes and you are good to go. So all these things could actually be the reasons why your infection keep coming back. Lastly, another reason why your vaginal infection keep coming back is uncontrolled diabetes. People with diabetes, especially if it's not well managed, are more prone to infection, including vaginal infection. High blood sugar level creates an environment where bacteria and yeast can thrive. This can make you have consistent yeast infection. And when you have consistent high blood sugar level, it can weaken your immune system, thereby making it harder for your body to fight off infection. So having uncontrolled diabetes can be the reason why your vaginal infections keep coming back. Always learn to manage your diabetes with the guidance of your doctor. So my beautiful ladies, these are the 6 reasons why your vaginal infections might keep coming back. Let me know in the comments, what do you think might be the reason why your vaginal infections keep coming back? Please don't forget to like this video, subscribe if you haven't, and turn on the bell notification so you don't miss a video. Share this video to everyone you know, all the ladies you know. Share this video to them because a lot of them would really want to see this video. And always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching and see you in my next video. Bye.